We want to turn right now to the story of a local woman who bravely became part of a clinical trial after being diagnosed with breast cancer. Laura Perry was just a month shy of her 40th birthday when she found out she had stage 3 triple-negative breast cancer.
Well, after a year of treatment in the trial, there is no more evidence of the disease. Now Laura's back to enjoying the outdoors with her husband and her 6-year-old son.
Happy to have Laura in studio along with her doctor and principal investigator in that trial, Dr. Andersen with Compass Oncology. Thanks both for being here.
Thank you.
Laura, let's start with you. Of course, we talked about the happy outcome, but it must have taken some time and really difficult times for you to make it there. What did this treatment involve?
Well, I had about 16 treatments of the hardcore traditional chemo. Along with that, I did the trial. And then I had surgery, I went through radiation. So it was quite a long battle.
And doctor, who can be eligible, I guess, for a trial like this?
So every trial will have its own particular criteria. So in this particular trial, it was people who were stage 1, 2, 3 triple-negative breast cancer, which is a higher risk type of breast cancer, and they received either preoperative standard chemotherapy or standard chemotherapy in combination with Keytruda, which is a immune antibody therapy.
Why did it work in Laura's case?
Well, we're still gathering data. The premise was, does the addition of the immunotherapy improve outcomes as compared to chemotherapy alone? We have early data in breast cancer that it appears to offer benefit, and this drug, Keytruda, is also approved in other cancer types. So the notion of immunotherapy in cancer is not completely new, but we needed data in specifically breast cancer, triple-negative, preoperative setting to confirm that.
So Laura, for anyone else who may be looking at a trial like this, what would be your advice before they get started?
To just go for it. I mean, you have nothing to lose. And for me, it was just give it everything I could to fight it. And I had no idea. If I was getting it, I had no idea. There's so many side effects that come with traditional chemo that honestly.
What do you say to someone who is as brave as Laura was in terms of putting herself out there and wanting to help other patients? You know, she had no guarantee it was going to help her.
Correct. And that is the spirit of a trial. The purpose of a trial is to gather more data and give patients the opportunity to have access to new, promising, exciting drugs that are not yet available. So it's fully voluntary with informed consent. And I think the data were, the preliminary data were very promising. So I think it's a complicated conversation between provider and patient to navigate that topic.
Well, Dr. Andersen, Laura, thanks so much for coming by today. This is Breast Cancer Awareness Month. And, you know, thank you to people like you who are making a difference in the fight.
Thank you.
Thank you both for coming in today.
Thank you.